Welcome students and welcome all the participants and scholars. We will continue. I have taken this as a part 2, but it is same which we have discussed in the previous that means just now the class, and you can see this is the program. In this program we have taken the same topic, we are continuing. And that is, I want to show is it is the herbs. What is the therapeutic insight of herbal drugs in COVID-19 virus, SARS-CoV virus. And in this here now we have taken to discuss about Kaba Sura Kudi Neer. Actually, we have talked about Siddha system of medicine, in which we have given various formulas. We have discussed actually for treating COVID-19 patient, in which we have seen that is Kaba Sura Kudi Neer 60 ml twice a day, and Visha Sura Kudi Neer, and even we have seen that Pavala Parpam and Velli Parpam. These are some of the things which we have told, and these Parpams they used to mix along with pure honey, and they told to consume for the COVID patients. So anyhow, we cannot go for all the formulation, but we can, at least today, I thought of taking to discuss about this Kaba Sura Kudi Neer. So this Kaba Sura Kudi Neer, it is Kaba Sura Kudi Neer. In the word itself, it says that Kaba means that is phlegm, Sura means the temperature, body pain, and Kudi Neer, we know that is Neer. Neer means water or liquid, which can the internal drink. So that's in the meaning. It says in Tamil as well as Sanskrit. Before going to talk about this Kaba Sura Kudi Neer, let me remind you what we have discussed in the just before previous session, in which we stated that the Siddha system has the humoral concept of Vada Pitta. That means there is Vadam, Pitta, Kaba. The three things which we have discussed actually. So Vada, Pitta, Kabam, when we were talking about that, it's also a very, very traditional practice and a system which is found 3000 years back. And before going to that, reminding you, I want to tell about a great poet which have been remembered by the whole world, and also you know that Tirukkural, which is a great book written by Thiruvalluvar in 1st century, that means 2000 years back. It has only two lines for every poem, and they are very, very effective, and they have many philosophy, and I hope most of the things you might have heard even from our Prime Minister, even he used to use this poem whenever he was delivering any speech. And this about this Vada Pitta Kabam system, he has told in long back. He has told in his poem that Mihinam Kurainam Noi Seyum Vali Mudalam Enniyadu or Enniya Moondu. Mihinam Kurainam Noi Seyum Vali Mudalam Enniya Moondu. This is the Kural. They used to say this is the poem. And in that poem, he has told that Moondu, I think that you can remember, that is 3. He has told Mihinam, that means the increasing of the Noi or decreasing of this system of 3 may cause disease in human being. What all the 3 which we have discussed? Vada, Pitta, Kabam. And also we have seen that ratio also 2:1 or 2:1/4. In decimal, if you want to say 2 or 1:1 or 2, that means 1 or 2 is 2.25. That means Vada is taken as 1 and the Pitta is taken as 1 or 2 and Kabam is taken as 0.25. So in this system, if it is imbalance in this ratio of these 3 humors, according to Siddha medicine, it will cause even imbalance to the human being, and a disease will be the patient will get immediately, immune system will get disturbed. That's what he has mentioned very clearly. So what will happen when there is somebody is having his immune system start working, when suppose a foreign body enters into his body, then immediately you can see that this Vada Pitta Kabam imbalance will cause Kabam, phlegm, Sura. It means, for example, Pitta. Vada means it's related to the inflammation, pain, muscle pains and body pains. Pitta is related to the increase in body temperature, pyretic. And when we come to Kabam, the phlegm, which causes in the lungs completely, and so that we can give even cough and sputum may come out, and this may be seen most of the time even in normal person who is getting any type of imbalance in his immune system. So this has been written in long back, and just he has given this. So this, even this Kaba Sura Kudinir is stated by, or not, it's given by, or you have collected from the data from Siddha system. They say that it's not a new formula which is invented, or it has been formulated, or it has been designed in this COVID situation, but it has kept long back. It has kept in 2000 years back. So it's a formula which is very much useful. We will have a discussion about these formulas. So in Kaba Sura Kudi Neer, Kaba Sura Kudi Neer, for imbalance in your Vada Pitta Kabam. So in this we are having 16, we are having not 16, 15, sorry, 15 drugs, 15 herbs are used in this formula, that all the 15 we are going to take as a discussion, not much, just what is its insight of its therapeutic insight and what is its application and how, just one line, and the details about the plant of their scientific name, that which I am going to deliver you, and so that these scholars who are listening and who are present in this session, you can just elaborate it and you can use in your future research. You can take as a challenge to do each and everything, and you can give the proof for the mankind and proofs for the public, so that how they can be, it can be more useful. And what I want to say here in Kabasura Kudinir especially, it's not only used in southern part of India, it has been used by most of the part of the India and as well as abroad. It has more value and it is very, very easy for any patients or any person who is suffering from COVID-19 virus or SARS-CoV beta virus, which we have discussed. So we can see all the collective 16 herbal drugs we are going to discuss now. And you see, this is almost, when you see the first one is Kostam. It's a Tamil name, Kostam, and Sanskrit is called Kut. And roots, especially roots, are used in this formula, most of them, and some of them are leaf dried form, and some of them are fruits which is also taken in a dried form, and we are going to discuss about that. Roots are major they have taken, and also we should think about that all of them, the formula they have given in Churana form and dried. All the 15 herbs which is used in Kabasura Kudinir, all of them are dried and they have been mixed and packed in equal parts, and it has been given everywhere in the market. So you have to prepare, that is Kabasura Kudinir, that means you have to prepare that Kudinir, that means you have to prepare the extract. So we are going to discuss about this preparation of the extract personally. That is also I have given a small detail in this lecture. So here this Kostam roots improve the blood flow and heal wounds. A good antibiotic herb for throat infection. And Kostam or Costa, commonly called as Costus, Sasuria costus is a botanical name, and this plant we have discussed in the previous session also. We said that it can be used for prophylaxis and as well as treatment of COVID patients. You can see it has a peculiar fruit. The flower even in the picture is shown, but we are taking the root for the preparation of this formula. These are the roots which is taken from this plant. Family Astraceae. Family Astraceae. In Malayalam, it's called as Kottam. And the number 2, the second plant or second herb or second herbal drug which has been taken for this Kabasura Kudinir is Adatoda Ilai. That means the leaf of Adatoda. In the dried form, fresh should be collected and it should be dried. And the leaf helps loose chest congestion, facilitates breathing, and treats upper respiratory infections like cough and cold. Even we might have heard about this Adathoda. It is also called as Malabar nut, and some places we used to say Adathoda Vasaka, because we know that it contains main constituents of vasaicin and vasacinol. They are mostly used as an expectorant, and it is more useful for children, and it can be used in our home itself. It's a very simple preparation which can be given. So we know this plant very well, and it is a plant which can be grown in our garden and in our home, and even if you are staying in a flat or in a building, you can have in the pot also. You can use this. And this is also a very important ingredient which is used in Kaba Sura Kudineer. Justica Adathoda is the scientific name, is a herb also commonly known as Malabar nut in English, Adosa in Hindi, and Vasaka in Sanskrit. And you might have seen this plant everywhere, especially in our place, southern region, in Kerala. You can see everywhere this plant is seen to be very common. And number 3, the plant which we prefer is Karpuravalli, or it can be called as Oregano. It's also a very important plant, and also its plant is seen in the garden soft and a spongy leaf. And the leaf fights against bacteria, improve airway, and prevent inflammation or inflammatory diseases. So we are talking about these inflammatory diseases, and we are taking these drugs, and it has effect against SARS-CoV-19. As we have discussed in previously, the replication of the COVID-19 virus, which undergoes various steps inside the human cell, where we can see starting from the binding site of angiotensin converting enzyme 2, and finally the formation of, it has mainly 8 to 9 steps are there for their multiplication and replication of formation of the matured virus from the human cell. So this all parts in which we can see that is inflammatory, where there is a place where is even some spots where we can use some of the things which can inhibited by the herbal or herbs, which can act on this part, and so that it can act as a prophylactic, and as well as it can be used for treatment of COVID patients. So this is one important leaf. So we talked about this is also a leaf, but dried form only used in Kaba Sura Kudineer. Oringanum vulgare. The scientific name is Oringanum vulgare. Family Lamiaceae. Oringanum vulgarum, you can see its family Lamiaceae. You can see the leaf, they are very spongy, and they have sometimes, you can see that is pharmacognostically, when you want to see that leaf, you can see many the trichomes can be seen even in the leaf, and after drying you can see the part which is showing the dried form of this leaf, which is we are using in the Kaba Sura Kudineer. And in Malayalam you can say it is Marwa. And the number 4, the plant which is selected is Siru Kanchori Ver. Siru Kanchori Ver. Kanchori. And in Tamil and in Sanskrit they used to say Kanchori. And Trachea involucrata. Trachea involucrata is the scientific name of this plant, and we are taking only the root of this plant for the purpose of preparation of the Kabasura Kudineer Churana. And what it is doing, this Kanchori root, it manages asthma symptoms and skin diseases. Trachea involucrata, this is the plant. The flower, you can see, it can be even seen in our place. Family Euphorbiaceae, but we are not using the leaf or the flower. We are using the root of this Kanchori Ver. Kodutova or Kodutuva, you can say, is the Malayalam name, and in Tamil, as I have written that Kanchori root. In Tamil, it is Kanchori root. And number 5 is Nilavembu. Nilavembu Samulam. That is, Samulam means actually, Samulam means whole plant. The whole plant is used. So the part of the plant which you are using for any type of preparation or any type of drug formulation in herbs, it is necessary to mention clearly. So in Nilavembu, Samola means the whole plant is used for preparation of this Kabasura Kudineer. Tireta, full plant has anti-parasitic and anti-inflammatory property. In Malayalam, Kiriyathu or Kiriyathu. And Nilavembu also, it is called commonly Nilavembu. Scientific name Andrographis paniculata. So Andrographis paniculata we have discussed previously. Andrographis paniculata. Andrographilin, andrographilin, there is a constituent which is androphilin, which is having action, which is having the inhibitory action towards the binding site of the SARS-CoV virus beta towards the angiotensin converting enzyme 2. There the inhibitory effect is there. So it can be used as a preventive measure. It can be used as a prophylactic, and so that's Andrographis paniculata. And also Nilavembu Kudineer, this was very commonly used when 2 years back we had a threat by means of dengue. But the dengue fever, when dengue we are treating, we used to give this Nilavembu Kudineer, and what it was doing, it improves boosting the immune system, and also it was very much increasing the number of platelets, which was seen to be reduced while dengue fever was seriously affected patients. So this was a very good drug which we have to remember, that is Andrographis paniculata. Family Acanthaceae. You can see this plant very common in our place. It looks like, and it looks like somewhat very well in the ground area, and also wherever we are going for the playground area or nearby home, we can see this plant very commonly growing. It's a beautiful and amazing herb drug which has increasing the immune power of human being. And sixth one, akrakaram or akrakara root. Here we are using the root. Previously in Nilaviyambu we are using the whole plant. Here you can see only the root which we are taking, akrakaram. So this root, when you keep in the tongue, immediately the saliva will secrete. That is where secretions will be increased, especially. We can observe that in a crude form itself. And the root for treating oral disease, sore throat, cough and indigestion, commonly it has been used in this system. And this drug also included in the Kabasura Kudinir. Anacyclis pyrethrum. Anacyclis pyrethrum. So this is also comes to the species under pyrethrum. But pyrethrum we might have heard about chrysanthemum pyrethrum. That is different, which are flowers which is used as an pesticide and insecticide. We are using that particular alkaloid which is having against of insecticide. So that is also very common, very interesting drug, a crude drug which or a herb which is used. But this is also same species, but Anacyclis pyrethrum. But we are taking the roots of this plant. You can see the plant is having a beautiful flower like chrysanthemum also. But you can see this is Anacyclis pyrethrum, which has a beautiful flower, but we need the roots of this plant. You can see the roots is collected and dried, and it is used for this preparation of churna of our kudinir. What is that kudinir which we are going to take? That is Kabasura Kudinir. Kabasura Kudinir. Akrakar, family Astraceae. It's an immune stimulant effect. Siruteku, Ajwan. Siruteku means even when we talk about teku means we know there is a big tree. But this is not that big tree, but it's a plant which is, you might have heard about fennel, coriander, caraway. This all, even dill, this all comes in Umbelliferaceae family root, and this plant also looks like same like fennel plant, and even it can be compared with even Asafoetida also, that also coming in the same varieties of plants which we can see. And its root is important for our purpose. Its root, and also you can see this Ajwan in Malayalam, we can say it is Omam. In Tamil also they used to say it's Omam. And this plant we are using it for home preparation, for indigestion and all. We used to take the fruit of the seed of this plant, but it's not used here. We are taking the roots for preparation of Kabasura Kudinir. Ajwan. And the root prevents cough and improves airflow, improves the difficulties in the breathing, improves the airflow, and has anti-inflammatory and antimicrobial properties. And the botanical name, Trachyspamum ami, Trachyspamum ami, also known as Ajwan caraway. Caraway means, you may be knowing, that is the caraway. It's a common which we are using, that means jeeragam, which you are using very commonly for our food preparations. And Siruteku, Ajwan, we can say this is the plant, the flowers and the roots, which is very important, but I just took to show you the fruits. It looks like Umbelliferaceae fruits. You can see that fruits which we might have seen in fennel, but the fennel will be little more longer, lengthier, and even caraway will be small and thinner. So they are different, but the dill is having a similar structure of this Ajwan. And see, the eighth one is Sinthil. Sinthil is another name, synonym name. You can say it is Giloy. Sinthil roots. Not roots, we are using stem here. So we are using stem, root, whole plant, leaf, almost different parts of the herbal drugs have been used for preparation of this Kabasura Kudinir. So what happened? The stem of this senthil stem boosts immunity, treats chronic fever, reduces asthma, and fights lung problems of the patients. So which we have in our target disease. SARS-CoV virus can cause this type of all type of complications which we have observed. A scientific name, Tinospora cordifolia, family Menispermaceae. Malayalam name Amurdavalli. This is a plant of the leaf which we can see. This is a climber actually. It is a climber. Like pepper nigrum, it is also a climber. So we take the stem part and dry, and it is used for Kabasura Kudinir. And number 8, the herb which is used in this Kabasura Kudinir is number 9th one is Korekkilangu. What is this Korekkilangu? That means it is a rhizome. It is a rhizome like ginger, that is Korekkilangu. Underground stem, you can say underground stem. What is rhizome? Nagarmutta. And you can say this rhizome has antibacterial effect, antispasmodic effect, and antioxidant is present, antioxidant effect, and it has managed fever and the stomach problems. It is also included in Kabasura Kudinir. It is a rhizome, dried rhizome. The botanical name, Cyprus scariosus or scariosus. Malayalam also it is called Korekkilangu only, Korekkilana or Korekkilangu. Family Cypraceae. See the leaf? It was like a star, like a number of leaves. It looks like a very, very characteristic plant which we can observe. You can see that rhizome. It looks like, you can see the cherry kilangu which we have seen in the market and which we are using for the food. It's also, but it's different variety. Cyprus scariosus or scariosus, Cypraceae family. And the 10th herb which is taken for Kabasura Kudinir is chuk, that means ginger. Ginger officinalis, which we have discussed already. We know that ginger is having more effect towards SARS-CoV virus to the patient which is already affected, and as well as it can be used as a prophylactic basis. What is present in ginger, especially for this purpose, you can see that 6-gingerol, which has the effect towards the inhibition of the entry of virus into human cell, where the spike of the angiotensin converting enzyme 2 can be inhibited by 6-gingerol, the constituent which is present in ginger. So rhizome promotes the digestion. It treats for asthma and respiratory illnesses also can be treated. Dried ginger especially we are using here for the preparation of Kabasura Kudinir. And in this we are using the dried ginger. The skin should be peeled off, which is used here. And number 11, you can see Vatta Tiruppuver or Vatta Tiruppuver. What is Vatta Tiruppuver in Tamil? Vatta Tiruppu, Vatta, it is like something circle. Vatta Tiruppuver. Legupata is a Sanskrit name. Legupata. The root is used. What it will do? The root improves digestion and other gastrointestinal problems is also included in this Kabasura Kudineer. In Malayalam, it is called Malatanti or Malatanti, you can say. Or you can say Pattathali. This is the plant which is shown in the picture. It is having a round, that's why it is in the Sanskrit they say Vatta Tiruppi, Vatta Tiruppu, Vatta Tiruppu. Then we are not using the leaf, we are using the root for this purpose. Vatta Tiruppi is in Tamil name and its botanical name is Sisamplus Pereira, family Menispamaceae. The plant which we can see in various places in wild also it can be grown, but we need the roots of Vatta Tiruppi. And the fruit you can see it's a reddish fruit which I want to show to identify. For example, the scholar or anyone want to do identification of the plant and the certification of the plant by a botanist is very, very important before going to any type of extraction or isolation or any type of specific research when you perform. So, authentication of the plant. So that's why I want to specify about the fruit, flower, leaf, all these things, pictures and just displaying to you. And the 12th one is Levangam, clove, krambu, which is very, very interesting plant, which is very interesting herb or herbal medicine which we are using in various sectors. You may be knowing about this krambu and the clove. The flower buds kills bacteria and promotes liver health. We have discussed the same drug, even how it can act against COVID virus, how it can act against SARS-CoV virus. We have discussed it has constituents of camphorol and it has many other constituents also, specifically flavonoids, which has the inhibitory effect of entry of the COVID virus 19. So that's also a main ingredient here which we are adding in a dried form. Clove, we know that Eugenia caryophyllus or Syzygium aromaticum, family Myrtaceae, which we have discussed before. And you see this, the number 13th herb drug which we are taken is Pippili. In some place they used to say Tippili also, long pepper. It's also a variety of the pepper nigrum, but it is pepper longum. The fruit reduces the cough, cold and throat pain. Dried fruit only we are using. Has antioxidant and anti-inflammatory properties, which is more helpful, which is more supportive for the patient who is suffering with COVID-19. And pepper longum is the botanical name, family Pipperaceae, commonly known as long pepper. Tippili or Pippili also they used to say Pippili, Pipali. This is the plant, this is the fruit which is shown in the picture. And the dried form, you can see dried form, even which we are using commonly in your kitchen for various. It's also having more effect towards spices. And number 14, The 14th herb which we are using in Kabasura Kudinir is Kadkai Tool. What is this Kadkai? Kadkai means Terminalia Chabula. Terminalia Kadkai. Kadkai. In Malayalam we will say Kadkai. That the skin only you have to use. The pericarp of this fruit only you have to use. It's called Kadka. Herod. And the pericarp, the outer skin of that fruit you have to use. Outer skin of the seed only you have to use. So you can see the pericarp. You might have studied about a fruit, about pericarp, mesocarp, endocarp, cotyledons. These all studied about the parts of the fruit. So you have to use only the pericarp of this kadkai. Powerful antioxidant, treats allergies and sore throats. Terminalia tabula is generally known as Hared or Harikoi in India. In Malayalam, Divya, Kadika, usually Kadika we used to say. This is that. We might have seen in the home also. And this is in the fresh green when it is the plant, the fruits. And the last one, the 15th herb which is used in Kabasura Kudinir is Mullive. This is also a root. You might have seen many roots which is used especially. So Mullive, root. It usually it's very difficult to get and it's very minimum quantity only they are using it here. So the roots are having immunity, and what is a Vajradandi it can be called, and also it is called that is Kokil or Kokilasha in Sanskrit, and immunity booster, treat stomach pain and urinary tract infection. It can be used specifically. The botanical name is Hydrophila auriculata. Hydrophila auriculata. Family Acanthaceae. Kokilasha. Vayal chulli in Malayalam. Vayal chulli. You can see the plant, but we don't want the flower or the leaf. We want only the roots. The roots are small. And now we are coming to a video regarding this preparation and what all the 15 drugs or 15 herbs which we have discussed now. In a one small video, very fast they will show. So you observe and you can just make yourself comfortable what all the roots and the leaves and the whole plants and the stem and the skin of the fruit and the flower buds and the fruits, dried fruits, what all the ingredients which we have used, you can make yourself thorough, and as well as it will be interesting for you to see this video, because this video is prepared by a Siddha practitioner, a physician which is practicing Siddha, and they have prepared this video, very amazing video and very short. So please observe and see that that is the costum root, first one, and next one is the leaf of Adathoda, and you can see the Jastica Adathoda. Then comes to the Karpuravalli. This is also we have discussed Karpuravalli leaf, which is sponge and soft, and this leaf should be dried, and it is very good for cough and common cold for children. You can give in water extract, and this is the leaf which is dried form. And afterwards you can see it is Koranchori root and Nilavembu, the root and Nilavembu, and this comes the Akrakara, which is secretes the saliva secretions, and it stimulates, as we have discussed, Akrakara roots. And afterwards Akrakara you can see Sirutek, Ajuan, and then comes you can see that climber which we are Setil climber, Setil Kodi, and there is a climber which you are taking as a stems, a dried stem which we are using, that is Senisphora cardiofolia. And next, that is the rule, the step which we are using it. And after this drying only we are using all these constituents. And the next one, and it has more value, and next one is kirangu, that means kore kirangu, and next one is chukku, that means ginger, dried ginger, the skin which is peeled off. And after the ginger we can see vattathirippi root, vattathirippi, that is which we have shown, the vattathirippi round leaf. And then comes clove, that is Syzygium aromaticum, and then pippili, and then comes the kadukai, that is the kadukai which we are using is outer skin, terminalia chabula. And afterwards we can see vallichul, that is that next root. There is 16 roots have been taken in a churana form, and this is the preparation of this, how you are going to prepare this Kabasura Kudineer. Take 1 spoon in a vessel and maybe heat it using the heating mandel, or you can use electric induction, or you can use gas, whatever maybe you can use. And take 300 ml of water for 1 teaspoonful of the churana of the 15 herb drugs and boil it. Boil it with minimum temperature, not keeping more high, because we have to extract. We should not lose all the constituents by means of overheating. So we need, it has good flavor, can be, you can observe while heating, slow and steady heating, and it has to be reduced to 1/6 of the quantity which you are making. So 300 ml, you have to make it into 1/6 quantity. At least it should come to 50 ml, and so that it can be easy for you to dosage. So and you have to boil it continuously and reduce the quantity up to it's come down. All the constituents will be extracted by the water which you are using it by means of heating, uniform heating, constant heating, mild heating, which should be very clear. And you can see that it's boiling. We should not make it very fast. And you see how it has been come down, and you can see that 1/6 or 1/7 he has made more. He has more time he has boiled and extracted. You can see the amount, how much in 300 ml he has taken, and it has become to somewhat 30 to 40 ml he has just made into a very good concentrated extract. So this dose will be more useful for the person to take, and so that he can, as we have discussed before, the dosage of Kabasura Kudineer can be given 60 ml for TID, can be, sorry, not BID, for 2 times a day can be given for the patient who is affected by corona. And also you can see this even if there is prophylactic basis, not taking all the time, you have to take only 1 or 2 times in a week can be taken as a prophylactic basis. It's not necessary you have to take continuously, it is not possible. And also always when the physician, that is, for example, better to discuss about the Siddha practitioners, and they used to give the advice stating that even it is not good for taking a person who is having an ulceration, all these things they should not take in empty stomach. Better they can take some food and then taking is good. But usually if the person is not having any ulcer issues or anything, it's better to take empty stomach. It will be more helpful and very effective. So you see that we have discussed about all the 16 constituents which is present in Kabasura Kudineer, and almost all the botanical names, and it's a small therapeutic applications we have discussed. And so that I hope my small lecture, which can give some support for the scholars, which you can elaborate it and you can make it more feasible and more useful for the whole society in this pandemic situation. Thank you for being with me.